I'm at Baptist MD Anderson Cancer Center, and today we are talking about breast cancer. And let me introduce you to Dr. Layla Samian. Thank you so much for having me today.
Thanks for having me.
Yeah, it's such an important topic. But how common, I guess, would you say breast cancer is?
Unfortunately, breast cancer is the most common cancer in women. About 1 out of 8 women can develop breast cancer through their lifetime. So it's prevalent,
yes,
especially in the Western countries.
And how is it diagnosed?
So a lot of times women can either present as a mass in their breast, or they could have skin changes or dimpling of their skin. But a lot of times we prefer, if it's found on mammogram, it's usually diagnosed at a smaller size and an earlier stage. So usually breast imaging can pick it up if you're having screening mammograms, or some women have symptoms, like a lump or changes to their breast.
Right. Let's talk about treatment options then, once they maybe determine that there is something there.
So, there is invasive breast cancer has opportunity to not just spread within the breast, but it could escape into the bloodstream.
Oh.
And so you have to have 2 parts in treatment for invasive cancers. One is surgery or radiation for the breast to control it in the breast or chest wall. The other part is medications or medical therapy to prevent it from circulating in the bloodstream or latching onto organs and metastasizing.
Right.
And those could be either hormone blockers, sometimes chemotherapy, there is immune therapy, there are antibodies, monoclonal antibodies that can be used with as part of medical therapy. And then local therapy is usually surgery and sometimes radiation.
And everybody's different, right? So it's not a cookie cutter approach, it's tailored to the individual patient. So talk about some messages of hope then, what would you say?
So if you, for prevention, we don't want people to get cancer in the first place. So there's things that you have control over.
Yeah.
And the main thing is your health and lifestyle. So we know about 60% of cancers in the United States could be prevented if we avoid ultra-processed food, maintained a normal weight, ate healthier, avoided alcohol, tobacco, things like that. So just maintaining a healthy lifestyle can go a long way in reducing your risk for all kinds of cancer.
Right.
And then the other thing is screening.
So important.
So important to get your mammogram. We recommend starting at age 40 and get it annually. And also be aware of any changes to your breast.
Right.
So be aware if you notice a change to the shape, the size. It shouldn't swell up. It shouldn't have any dimpling, or if you feel a lump in your armpit or your breast, you should definitely bring it to your doctor's attention, even if you just had a negative mammogram.
Oh, really? Okay.
Yes.
And you want to consistently do that so you know what it feels like normally.
Normally, correct.
And then so that way you can detect if there is a change. And we were talking off camera a little bit about what can be done to preserve sensation and things like that. That is all offered here as well.
Yeah, so unfortunately, if you develop breast cancer and need treatment, you shouldn't be afraid, because we do everything to not only treat the cancer appropriately, but also maintain your body in a way that you have a good quality of life.
Well, I think it's wonderful what you all are doing here to help.
You.
And again, they want to empower you to, again, with the prevention and the screening. And then, of course, they're here to help if you need it. So, Doctor, thank you so much for having me today and telling us all about what you offer here.
Thank you. My pleasure.
Of course. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.